We'll also address the importance of several childhood diseases, the impact of vaccines on the immune system, and the epidemic rise of chronic diseases in the last 6 decades. So, with no further ado, here's Andreas Bachmair.
Thank you. Thanks. Okay, so let's start. How did I start with the topic vaccination? So I myself, I have to go back 30 years. And I was 17 by then, and I was bitten by a free-running dog. And I got really crazy. So because I thought, well, this dog must have rabies. That's what I thought. I was convinced that he has rabies. So I even convinced my doctor that I definitely need a rabies vaccination. So I received this rabies vaccination, and a couple months later, I was diagnosed with diabetes. So, what the thing with the diabetes, this came to my mind month or years later, that there was any thing with the vaccine involved, so that there was any, what do you say in English? A link between the two. So actually, this came up years later. But this was it was not fate, it was even destiny that I'm doing this vaccine research now. And I was studying economics, so I did something totally different. And then I switched to healing practitioner. So I'm actually from Germany, and so I did a healing practitioner study. And I was more and more involved in this vaccine topic. And 2010, I started on my website, it's impfschaden.info, I started a survey. So it's a survey, it's not actually a study. Because a lot of people, they always say, well, this is a study I'm doing. It's not a study. It's an online survey. And I'm doing this survey on these two websites, impfschaden.info and vaccineinjury.info, on the state of health of unvaccinated children. And I'm just asking people about the state of health of their unvaccinated children and also of the state of health of their vaccinated children. Because a lot of families, they don't have just unvaccinated children, getting more and more, but most of the families, they have the first kids are vaccinated, then partly vaccinated, and the last ones are totally unvaccinated. So I did this study, and you can have a look. So where's this button? Here. Right. So it's close to 25,000 people right now, and they're both from the German and the English website. And you see most of the participants coming from the United States, United Kingdom, and Germany and Austria. And some Switzerland. I'm practicing in Switzerland now. But you see, these are the most participants. And what I want to mention, it's ongoing, so you can still take part in that. So this will be an ongoing project till I have maybe 100,000 people or even more. So I asked different questions. I asked them, what's back here? So there's a delay here. Okay. I also asked them what their conventional or what their preferred treatment is. And most of the people, they said homeopathy, then naturopathic medicine and other. And the other treatments were other natural treatments, most cases, not homeopathy or naturopathic medicine. So some people said chiropractic medicine. They don't put that in the category of naturopathic medicine. And you see 20 people are just in the conventional medicine treatment group. So this means that it's a certain part of the population is doing this survey. So we have to put that into account. So not all the people who are taking conventional medicine took part in this survey. So what was the reason why they didn't vaccinate their children? And mostly came, so the most common reason was that they were concerned about the ingredients in the vaccines, and they had, they feared the side effects, or they fear the side effects. And what's surprising is that they were convinced that vaccines are not effective. So they don't work. And even the first number here, if you look at this here, this graph shows the people who said they didn't vaccinate because they have a vaccine damage in their family or with friends. So this is a huge number, 25%. Oops, back. I'm too fast here. So just a little glimpse that you can look at the age distribution. You see most of the participants are very young, and the more participants they are, so I have more older groups in here. But right now I'm working on a follow-up study or follow-up survey that I'm just contacting all the people who took part at the beginning in 2010 and 2011. To retake the study. So to make a new group, because all these kids, or a lot of these kids, which were between 0 and 2 years old, and they are now like 7 or 8 years. But this is a little complicated because I have to deal with my tech expert who is doing all this database stuff. So I can't do that, so I need a little help there. So I just are going over some disease topics or disease groups just to see the difference between these two groups. And here you see the state of health of unvaccinated children with atopy, so with allergic diseases like allergy, hay fever, asthma, or neurodermatitis. And you see like it's 9% allergy rate with the unvaccinated, 2% hay fever, 1.9% asthma, and 6% with a neurodermatitis. So if you look with the vaccinated, if you look at the allergy rate, let me see, where does it, here, it's 3 times higher, the allergy rate. If you look at the hay fever rate, it's 5 times higher. Asthma, the same, it's 5 times higher, and neurodermatitis is 3 times higher. So this is, although it's not a double-blind study as we have seen before, it's still, I think, it shows a trend. And the numbers are the same whether I take the German or the English groups. So they are pretty much the same. There's not much of a difference. If you look at other diseases like otitis media, sinusitis, herpes, warts, polyps, or fungal infections, what's the difference here? Let's have a look. Oh, I'm too stupid here for this. No, vaccinated. Look at that. The first number, you probably won't see it in the back. So if you take the first bar, oops, sorry, you haven't seen it? Okay. Otitis media. So it's 25 times higher with the unvaccinated than the vaccinated. So the vaccinated have a 25 higher rate than the unvaccinated. So it's over or close to 40% that the vaccinated, once in their lifetime, they have an otitis. And look at the unvaccinated. So the percentage here is 1.63%. That's amazing. And also the other groups. So if you look at sinusitis, it's pretty much the same. It's 15 times higher. So These two groups, they show the link between diseases and vaccines, which have a strong impact on the immunity of the kids. So this shows that vaccinated children have a really low immunity. Take polyps, 23 times higher. Take herpes, 11 times. Warts, 12 times higher, and fungal infections 9 times higher. And what's very interesting is that I get a lot of reports from the parents. They just send me stories about their children. And this is the next thing. This is a typical report I get from vaccinated children. And if you just read that, it's, well, my son acquired both a metabolic disorder and an immune disorder after a vaccine reaction. He has been chronically sick since that day. He's now 14. He regressed at 15 months. He suffered an infection with fever roughly every 2 weeks since regression. He has too many bouts of bronchitis, ear infection, strep, staph to count. Pneumonia 9 times and meningitis twice. My son cannot even fight the bacteria that gets introduced when an insect bites him. Well, this is just a little example, but they are very similar. I don't get these stories from parents with unvaccinated children. Never. I didn't have even one really, well, such a story. I'll show you one more later. So I ask for other disease, like ADS, hyperactivity, autism, sleeping problems, concentration problems, and migraine. And also here we have this huge difference. Here, 5 times more sleep problems. Then I asked whether the baby was a crybaby, so 5 times higher. Concentration problems, 18 times higher. ADD, attention deficit disorder, 35 times higher. Hyperactivity, 8 times higher. Autism, 14 times higher. And migraine, over 30 times, 33 times higher. So we also have autism in the unvaccinated group. But the difference here, because I always ask the people, when they just cross autism or something, I write to them. And I write them so they should elaborate a little on the history. And then they write me back, and most of the cases, so almost all of the cases are very mild autism cases in the unvaccinated. So they are not severe autism cases in the unvaccinated group. So, well, there are probably some cases which are fake cases here. So we have this term now, the fake news. I probably have these fake cases also therein, because sometimes it's hard to differentiate whether it's a fake case or not, but I can filter out most of the cases, which are really fake, because some people just cross everything, and so I can filter these out. Have a look at some other report. Not happy vaccinating as only became anaphylactic to egg after vaccine administered. Behavior changes happened. Speech went backwards. Stopped talking, stopped walking. Doesn't make eye contact. This is unfortunately, this is very typical also. I've been treating vaccine damages for years now in my practice, and I've seen many cases of vaccine-injured children with speech disorder, developmental delay, or developmental stops after vaccinations. So, and sometimes these people, they write, well, other than the speech delay, the child is very healthy. So it's kind of sometimes it seems that people who vaccinate their children, these diseases, they are normal. Or they have allergy, and they write back, well, the child is healthy, well, it has the allergy against chicken, against egg, against I don't know what. But otherwise, the child is healthy. So then I even asked for autoimmune diseases, diabetes, epilepsy, seizures, thyroid diseases, and neurological problems. And here it's also very significant, the difference. So with diabetes, the thing is here that the group is still too little, too small, right? It's too small to tell anything. So we probably need way more people to say that there is a significant difference, but the difference still here is 8 times. Also with seizures or epilepsy, the difference is 10 times. Neurological problems, it's over 20 times. Autoimmune disorders, it's 18 times. And this is actually, I once looked up the prevalence of autoimmune diseases in Europe. And the prevalence depends on the country, but the prevalence of autoimmune disorders in Europe is between 5 and 7%. So this falls quite into this category here with 5.68% in the vaccinated. And thyroid disease, like 15 or 16. Why is it not working here? 19. Okay, I have to press harder.
Press to there. No, here. Up. And the beamer.
Why it's going there? It's going this way. Oh, okay, I'll hold it this way. I also asked the parents who vaccinated their children how many vaccinations they received and whether there is any link between the number of vaccinations and the disease rate. And I just showed the seizures and the neurological problems with the kids. And you can see the more vaccines the children receive, the probability to getting this disease is rising. So, well, sometimes you have a little bump in there, so between 7 and 9 vaccinations, but this is probably has to do with that maybe in the group there are not that many people with 7 to 9 vaccinations. So, but you see the trend. You see the trend, so the more vaccinations are given, the more probably the illnesses get. And 41 to 50 vaccinations, this is not that common in Europe. These numbers come from the US because in the US there are not these multi-vaccines given. So we have here in Europe, we have 5-fold vaccines. And in the US, they just give single vaccines most of the time. So you get a vaccine, one in the upper arm, in the left one, then in the right one, then in the right foot and in the left foot. So what can we see here from these numbers? You see that although we have less and less acute illnesses, we get more and more chronic diseases. So we didn't have these chronic diseases 100 years ago. We have these diseases coming up since the age of vaccinations, since widespread use of vaccinations. And you see multiple sclerosis since 1950 is going up 300%. Crohn's disease, another autoimmune disease. Diabetes type 1, it's an epidemic right now. And asthma. And all these diseases, they are going up since the 50s.